grateful for PNC's leadership in this space, not only in the Miami Valley, but throughout the state. It's now my great pleasure and honor to introduce my colleague, Don Buskey, who has many, many roles at ProMedica, but the most important and my favorite one is president of the Russell J. Ebeid Children's Hospital. Very active in Northwest Ohio on multiple levels, but she's also vice chair of the Ohio Children's Hospital Board of Directors, and she's here to introduce our keynote. Dawn.
I'm glad to see everybody's back from their break, and we're trying to catch up on a little time here. It is my pleasure to be here to introduce our distinguished keynote speaker, Dr. Brenda Jones-Harden. By now, you've heard some of the reasons why Vote for Kids, the coalition, is passionate about creating a strong foundation for Ohio's children. No one knows how critical these early years are like Dr. Jones-Harden, who's coming to us today as the Ruth Ottman Professor of Child and Welfare at Columbia University School of Social Work and the President of the Board of Directors for 0 to 3. For more than 35 years, Dr. Jones-Harden has focused on the developmental and mental health needs of young children and environmental risks, specifically children who have been maltreated, are in the foster care system, or who have been exposed to multiple family risks such as maternal depression, parent substance abuse use, and poverty. She's an expert in the infant and early child mental health and child welfare, and we are thrilled to have her here today. So please help me welcome Dr. Brenda Jones-Harden.
Thank you. Thank you. Thank you. Thank you for that nice introduction, and thank you for the Leadership Forum for bringing me to Ohio. I have to tell you all, for the last 30 years, I've been coming to Ohio about 3 or 4 times a year to visit my husband's huge family in Dayton. He has probably about 50 first cousins who all live in Dayton. And when we come up here, we have these big family gatherings where we go to church and everybody's singing. I had never experienced anything like that in my life until I started coming to Dayton. So I am hoping actually that they don't know I'm here because I am going home. I'm not going down the road to see them, so fingers crossed. Anyway, I'm here to talk about the things that really have driven my career for now almost 40 years, if you all can imagine. I started my career as a young social worker. My mother said, I did not raise my child to get killed in the tenements of New York City, which is where I learned about the import of the work that I would spend all my adult life working on. Now I'm not going up the stairs of those tenements as much as I used to, partly because I have arthritis and can't walk up all those stairs. But the other reason is I really thought about how I could make a bigger impact. And I remember my advisor in graduate school, because my first degree was in social work, my second degree, my doctorate degree, was in psychology. And he said, you can impact the 12 kids, 15 kids you might have on your caseload, right? Or you can impact the thousands of kids in America who need somebody to advocate for them. He went on to say you can advocate for them from the advocacy platform, but you can also advocate for them as a scientist practitioner. And that's what I've spent the last 25 or 30 years trying to think about. How can I distill what we learn from the science about children to people like many of you in this audience who work with children's programs on a day-to-day basis? So that's what I'm here to do. They only gave me 30 minutes. How can I talk about the things that I've spent 40 years doing in 30 minutes? But I'm gonna try. All right. So the first thing I want to do is start with a quote. I'm going to start with a quote, and I'm going to end with a quote. And I love this one. I give it to my students. I only teach one class a semester anymore, so I can't do all that anymore either. But I start with this quote, and this is from Nelson Mandela. And he said, there can be no keener revelation of a society's soul than the way in which it treats its children. right? And I would argue that this leadership forum is showing that you all have a soul, that you are really trying in the best ways all of you can, from the business community to the human service community to the hospitals, to really try to make Ohio's children's lives better. And so the things that you all have listed as a priority, the things you want to work on, are the things actually that I've spent the last 40 years or so of my adult life trying to work on, okay? So I'm going to do two things today in my 30 minutes. One is to try to tell you why this is so important, and then to talk a little bit about what we think we know will make it happen. So let's start with poverty. What I say to my students is this is the great disequalizer, right? Poverty. And yes, mental health, and I was trained as a mental health clinician way back then and continued to see kids for many times at National Children's Hospital, by the way, in Washington, D.C. Spent 4 years there seeing kids as a mental health practitioner. Here's the thing, that poverty, yes, as somebody said earlier, it crosses socioeconomic class, it is true, but poverty has the impact of making everything worse, right? Creating disparities that all of you know about. So one thing I want to say to you, I don't know if you paid attention to the recent New York Times article, a week or so ago it came out, showing that child poverty is on the decline. Hallelujah. Did we ever expect to see that? No. And I'm going to tell you why they said it was on the decline in just a minute, but it is on the decline. But the thing you need to pay attention to, and this is why researchers, I'm glad Governor DeWine talked about research, but one of the things that researchers are arguing is that we have to disaggregate our data. So we can't just look at overarching trends because, yes, it looks like poverty's on the decline, but there are a couple things that you should know about that decline. One, that there are disparities in the decline. So children from minoritized backgrounds still experience higher rates of poverty than white children, not middle class, white children, right? But the other thing is that something happened in 2021. And what that was the child tax credit. Right? Now, all of us had hoped that it would catapult us into an era where all families continued to get it. We didn't get that. But now we have data that shows that you can precipitously decrease poverty, child poverty, with the child tax credit. And so if I were you, I'd be pushing for something similar to that for the families of Ohio, since it didn't pass in the federal government. The other thing that I would mention, which is consistent with this whole leadership forum, is that young child poverty is the worst. So yes, we have seen poverty decrease, but there is an age disparity that young children tend to experience more poverty than children of any other age group. And the bad part about that is it's more pernicious. What that means is that young children who experience poverty experience it longer, right, because they're starting earlier, that makes sense. But the worst part of it is that their outcomes are worse. For some reason, older children, maybe because it looks like their families cycle in and out of poverty, but older children tend to experience fewer adverse outcomes than young children. So my argument is, and again, I was trained as a mental health clinician, is that if we don't do something about poverty, all of our beautiful treatment, and I know we don't have enough child psychiatrists, which I've learned about from my colleagues, and we don't have enough psychologists, and we don't have enough social workers to do the mental health work. We need to do something about that workforce, but if we don't really try to address this kind of structural issue, we are going to be in trouble, okay? So my colleague and I just wrote a paper on SES disparities. We did a review paper, just turned in a month ago, and this is our graph. And I decided to put that in there because what it suggests is that poverty is a very complex phenomenon. It's like my advisor from grad school, who was one of the architects of Head Start. His name was Edward Ziegler. He died a couple years ago, and I bring him in to every presentation I have because he really said when he was dying, I depend on you all to keep my message going. So this is partly for him. But what he used to say to us is that poverty by itself is not really the issue. It's everything that goes along with it that's the problem, right? So it's living in segregated, poor communities. It's living with school systems that are really terrible. If you all know about the early childhood work, you know that we can see, like the person who was right before me talked about Perry Preschool, right? Well, we still have beautiful exemplars of programs like Perry Preschool. You get these kids up, you get them ready for school, and guess what happens? The data show us that they don't stay ahead. The Tennessee study you all may have just heard showed that kids who had Tennessee pre-K looked worse than the control kids. Why is that? One reason is because of horrible schools that they end up going into. So that's a problem, and we have to do something about that. And we have to do something about supporting the families with whom these children live. We can't leave them to try and figure out how to keep their children safe from violence and tell them at the same time we want you to volunteer in the classroom. Asking a little much. So the issue is, and I know this is a complex figure, but what I'm trying to point out to you is that there are so many things that we have to address to get children to where they need to be. Okay. I am not a brain scientist, but one of the things in my field now is that if you don't get on the brain train, you do not get any funding. So I have to tell you this. So my most recent study is a study where we're looking at, with two colleagues who know about the brain, because I'm a consumer of this science, but I have a great colleague who's been doing EEG for 50 years, and I have another colleague who's been doing MRIs for like 25. And so the three of us are the PIs on this project. That's a national project, 25 sites across the country, where our question is simple. What is the impact of early adversity in children's brain and behavior? That's the research question. Now, let me tell you, that study is one of the most complicated studies I've ever been involved in because we have to find moms who are willing to bring their newborns in to have a brain scan. Wish me luck, wish me luck. But at any rate, the data are pretty compelling already. NIH wants us to be able to have 7,000 kids. That's what we're supposed to end up with, not just my site, but all the 25 sites, 7,000 kids across the country, because they want to move beyond these little studies that we have. But what the little study suggests is that poverty affects children at the level of the brain, not just their behavior. So if their brains are being affected, why are we surprised that they are throwing chairs in the Head Start classroom? Why are we surprised that they can't learn their ABCs, right? Now, this is the temporal lobe, and for those of you who are consumers of the brain science like me, you will have learned that the temporal lobe is this part of the brain right above your ears, right? There's a reason it's right above your ears. This is how you process language. And for those of you who don't know the developmental literature, language predicts everything. It predicts whether you learn how to read. It predicts whether you can learn math. It predicts whether you have high rates of behavior problems. So oral language turns out to be so critical. And what this particular slide shows us is that when you are experiencing deprivation, that part of your brain is affected. Now, this is a PET scan. It's not an MRI scan. It's a PET scan, which, and my colleagues from the children's hospitals will help me if I get this wrong, but my understanding is that it's what helps you, tells us whether the brain is processing glucose, right? The metabolism of the brain. And usually, these kinds of things occur, these PET scans in our kind of research, when you're given a particular problem to solve. Like, being able to, repeat words or know what picture matches a word like you do with a PPVT test or something like that. And what this is suggesting to us is that for children who've experienced deprivation, they are not using the same amount of energy to process a problem. And if you're not using that brain energy to process a problem, you won't solve it. So again, why are we surprised that our children look so bad when we look at their achievement scores? Okay, I'm not going to go through this. You all know this. I just wanted to point out about poverty again, the great disequalizer. It impacts physical health outcomes, and somebody mentioned infant mortality. And you all know that the reason children mostly die are because of prematurity, and we got to go back, not just focusing on the children, but I got to focus on their moms and make sure they get the correct OB care. There is a lot of research about women feeling like they are not heard when they come into the hospital and they say, something's wrong, I don't feel like something's going right the way it's supposed to be, and people don't listen, right? So if we're focused on child outcomes, we gotta focus on maternal outcomes, particularly in the perinatal period. And you all know about the maternal mortality rates, particularly among African American women, higher than any other group, higher than poor Latino women even when they're in the middle class, which suggests, okay, that complicated part about poverty, racism you have to think about, and how Black women experience the healthcare system. There's a lot of research about this. If you don't believe me, go look. Listen to Serena Williams. She'll tell you about it. Okay, so you all know about the achievement gap. I'm not going to go into a lot of detail. The only thing I want to say to you all is the achievement gap does not start in elementary school. It starts in early childhood, right? And we know, oral language again, if we look at the oral language of 2-year-olds, we can predict whether they're going to be ready for school. So as someone said about the mental health problems in that video, and she was absolutely right, we can predict later mental health problems in preschool. We can also predict academic failure in preschool. Okay, so we really got to, if we're really thinking about prevention, and I started my work working with kids of all ages, but if you have followed my career, if you look at my Vita, I've gotten younger and younger and younger over the years because I'm so committed to this prevention idea. Okay, I'm not going to say a lot about ACEs. I just want to say that you all know, now we got money for it, that ACEs predicts physical and mental health problems. I knew that 40 years ago. But now we got beautiful brain pictures, and we got physicians looking at it who are now relating it to physical health outcomes. So now everybody wants to give us money, which I'm happy to take. Now, here's the thing that I want you to remember though. Just because you've experienced ACEs does not mean you're going to have bad outcomes, right? So what we have to learn, and this is the resilience literature that comes out in my field, we have to see what those children who have good outcomes experience. What is it that they get that other children don't? And we've learned some of that. One of the things we've learned comes right out of Jack Shonkoff's Center for the Developing Child, and if you all haven't looked at his website, beautiful things that you can use to train your staff, to advocate, free, you just download it. But what he argues, he has this framework called toxic stress, and you all might remember this. But the important thing that he argues is that, yes, children experience poverty and violence and maltreatment and racism and segregation and all these bad things that we know cause them to have adverse outcomes. But he argues is if you have the protection of a responsive, stable, caregiving environment, your outcomes are not as bad. So while we fight to get another child tax credit, while we fight to decrease poverty, while we fight to decrease racism, which all of us as advocates should do, there is something we can do for children in the interim that might help. And that is making sure that they have the kind of responsive caregiving environment that we know will help them have better outcomes. Now, does this have to be mommy? No. Does it have to be daddy? No. Does it have to be grandmommy? No. It can be a good child care worker, which is why if we don't pay these ladies, don't get me started on the workforce issues. People want to know why we're losing them in droves. Ask yourself what their paycheck looks like. Ask yourself, are they any better off than the families they serve? It's pitiful. All this brain research where we know how important stimulating children's minds are in the earliest years of life, how plastic the brain is in the early years of life. And we are paying these ladies what we pay them. And you all know they're primarily women of color, right? That's who they are. We should be ashamed. So again, a question I'd be asking the people who are running for governor in my state is, what you gonna do? And I don't just wanna see retention bonuses, although I'm so happy that states are moving toward those retention bonuses. I'm really happy. But I wanna see them start at a reasonable pay that really is consistent with what we're asking them to do. Okay, so this particular slide really just says what I just said, so I'm not gonna stay here long. That if you're really serious about prevention, you know that you get the most bang for your buck. And this is about the brain, but if you look at the return on investment that the economists like Jim Heckman are talking about, you see the same kind of trend. You get more outcomes for what you invest if you invest early, which is why this forum is so important. We really need to be not waiting until those children are showing up at the children's hospitals at 13 with a suicidal threat, right? Because if we can get to these parents and help them understand who their children are, how they have to respond to them, what they have to do. There's even some research now that says that spanking affects your brain. Now, this is a tough issue for me. I come from a family of spankers. I can't tell you, I was spanked with a belt, I was spanked with a paddle, you know, I had a forked switch at my grandmother's house, and I used to have to go get the switch off the tree. You know, this is where I come from. So imagine me saying to my family, I am arguing against spanking, and they say, see, that's that Yale degree. They don't appreciate it at all. But the point I'm trying to make is there are things we know that we need to help parents to do early on. And we're not getting to them. We're not helping them see what they need to be doing. Okay, I'm gonna skip this slide. I wanna say that if you are really serious about taking a prevention strategy, you need to think about it from multi-levels. And this really comes right out of public health, right? Which says that you have to think about what you're doing for the whole population, like we do not have a population who knows how to parent. We should be doing something for all of our parents about parenting. Maybe they can get it in high school, maybe they can get it at the children's hospitals, but someplace, maybe they can get it through the home visiting programs, someplace where parents can learn what is it that makes a difference for my kid, right? But also, primary prevention, this is where we can think about making sure every parent starts their family with a reasonable income, right? That's the other thing. And by the way, we have learned one of those reasons for that reduction in child poverty also has to do with the expansion of the safety net. Now, there are people who don't like TANF, even though we've made the changes very different than what it looked like when I first started my career. Medicaid, SNAP, and I have a slide on that I'll get to really quickly, but those safety net programs make a difference in terms of whether parents are able to do what they need to do. Okay, and on the secondary side, we have things like the early care and education that you all have been talking about all day. But I gotta say this one thing about early care and education. You all heard my, very distressed comment about what we don't pay. The other thing we don't do is know what's happening in those classrooms. And if teachers are stressed, which a lot of our teachers are, because as one of the people in the video said, 4 little challenges, I love the way she put it, 4 little challenges. I would have said something different. But what she's talking about is teachers. I had a teacher in one of the classrooms that we worked in where the kids were hitting her with their fists. And she had 17 boys and 5 girls. Now, whose bright idea was that to put 17 little boys in one classroom? I don't know. But the point was, she was so tired. I would not have let that teacher be in that classroom by herself all that time. Now, she had an aide, but the aide didn't know what she was doing. That's the kind of teacher who we should have put our arms around, given her more people in the classroom, and we ended up using our research team to go in and help her, because it was ridiculous. She could not do her curriculum. She was too busy trying to keep children from knocking each other on the floor. So we can't just say, are they meeting we have QRS in our state, but the quality standards. We need to be in those classrooms supporting those teachers to deal with the kids that they have. And then finally, all the mental health interventions that you all know really well. I just want to say one thing about the mental health interventions, and obviously I have been one. It is a very singular kind of intervention. And I had a colleague who said, school is the best form of mental health intervention. And what he was arguing was what you get in schools, a good school, by the way, he wasn't talking about some of the schools we see, but the routines, the adult support, the helping you get along with peers, the ability to give you something to focus on instead of thinking about the gang activity and the violence in your home, that is a mental health intervention in and of itself. So I want to encourage you all to think a little more broadly about what mental health support is and think about it in terms of providing children with the milieu before they end up in the hospital that might get them the positive social outcomes we want. This is my slide quickly on safety nets. I am sorry. We gotta keep these alive. And there is some research that suggests in states with expanded Medicaid, with more flexible TANF requirements, with expanded eligibility for SNAP, you can see things like reduced child maltreatment. So my argument is fight to keep these alive in your state. All right, and then I want to say something about your integrated service delivery system that you raised. There are a lot of my colleagues who've talked about this. I'm an early childhood person, as you all know, so we think about it in terms of early childhood systems. But one of my colleagues, Ken Dodge, has a program in North Carolina called Family Connects. And he really believes in that multi-pronged, multi-level prevention approach. And he has written several papers, look him up, Ken Dodge, where he argues for a more universal population-based approach. And he feels, and we'll see if he's right, because he's tried this out in North Carolina, he feels that if we go at it at a population base, there'll be less stigma and we'll get to all families, right? And so his program provides a home visit to every mother who is born in Durham, North Carolina. Every mother who delivers, sorry, not born, every mother who delivers in Durham, North Carolina is offered a home visit. And in those 1 to 3, sometimes they get 3 home visits, they make a determination whether a parent, a family needs more support. And from there, they go on to their early childhood system of care that includes early Head Start and Head Start, that includes child care, that includes infant and early childhood mental health, that includes a medical home in their community, that includes child welfare services, who, by the way, have more prevention money than they used to have. So we don't like to think about them as a partner, but they should be a partner. They should be a partner. And he is able to get families to those different places. So I would encourage you to think about a couple things in terms of that. Having a central registry, if you will, a central way that families come into your human service system and figure out what they need. Now, this requires a lot of collaboration, but you all have the kernels of that right here, right? Where you can create this kind of system. Washington State has done some amazing work in this area. New York is doing some work where they're bringing all these siloed child serving systems together, and they're really thinking about how can we use our money more efficiently and use our money more wisely and make sure that, because it's the same kids, as you all know, you go to any system and you got the same kids and families who are served by most of these systems. So they're using their money in a more cost-effective way. I'm going to end because I know that I only had a certain amount of time and we're already late, and I said I was going to end with another quote, and this is Thoreau. Remember Walden, going to the woods, and this is what I do when I get burned out. I go to the trees. My mother says I'm a tree child. That's what I do on my birthday. I find the park that I haven't been to, I go to a different park. I don't want a party. I don't want birthday cakes. I need to go sit by a tree and calm myself down and think about what am I going to do and how to keep myself from being burned out. And I've been doing that for a long time, and it helps. But anyway, this is Thoreau Walden, who first introduced this little urban child from DC to how you can go meditate in the woods. But this quote is, "Kindness to children, love for children, goodness to children, these are the only investments that never fail." And that's what I've kept myself doing all my career, and hopefully you all will too. You're